Good morning. So I'm going to welcome you to Dr. Cara Davey, clinical psychologist, who is going to talk to us today about what is trauma. So I'll hand you over. Dr. Cara Davey, over to you.
Thanks. So I'm talking to you today, as I say, about trauma. Now, the reason I want to talk to you about trauma is it's something that I'm very passionate about. And I've worked in NHS major trauma service for 6 years, and I also work privately for Cara, clinical psychologist in Sussex. And a lot of the work I do is trauma, both with adults and children. So I just wanted to give you a bit of information about what trauma is, what PTSD is, how it affects us, and how COVID-19 is probably making that worse for us right now. And then I'll hand back over to Dr. Debs, who's going to give some strategies that might help us right now. Okay, so what is trauma? Trauma is a severe emotional shock and pain that's caused by an extremely upsetting experience. Now, lots of people are affected by trauma. That could be that you experience anxiety, it could be you experience low mood, it could be obsessive compulsive symptoms like hand washing, it could affect eating, it affects a whole range of things. Now, lots of people will also have heard of the term PTSD or post-traumatic stress disorder. Now, this is an anxiety disorder caused by trauma that has quite a distinct kind of group of symptoms. So things such as what we call intrusions, such as flashbacks, things coming back into our mind of the traumatic event, feeling as if it might be happening again, maybe having dreams of the trauma itself or related in theme, having physical reactions where you can't breathe, feel kind of panicky or heart pounding, what we call the fight-flight response, which Dr. Debs is going to talk through with us a bit more about that later. And people also have a group of symptoms called, that we kind of term avoidance. So they might try not to think about what happened, they might try not to talk about the event, they might find that they even have trouble remembering it. They might not want to do things that they used to enjoy, and they might feel quite cut off and kind of emotionally numb from people around them. And then we also talk about kind of hypervigilance, so people having trouble falling asleep or staying asleep, feeling very irritable, kind of having angry outbursts, difficulty concentrating, and feeling generally kind of on guard and super alert to kind of jumpy and easily startled, and just really very sensitive to threat. So if we think right now, about the news and what's going on with COVID-19, it is constantly talking to us about threat, about harm, about stay inside, something bad could happen to you or your loved ones, which of course is going to exacerbate that feeling of hypervigilance. So if you're struggling already with a trauma reaction or with PTSD, it's going to exacerbate that. Now, also with COVID-19, we're being asked to stay away from our loved ones unless they live in the house with us. So for those who are avoiding, they cannot get away from the family in their house when actually they need to regulate their emotions and they need a bit of space because they can't really get out of the house. But also when some people try and regulate how they're feeling by seeing grandchildren or family members who make them smile and make them laugh, and actually at the moment they don't have the ability to go out and see them because they're having to stay at home in that kind of house. Also, in terms of the kind of intrusions and the nightmares, we know that they increase at times of stress. So if we're already feeling stressed by everything else going on, and COVID-19 is adding to our stress, it's likely to increase that and increase our difficulties with sleep. So I just want to share something with you. So just to think a little bit more about how PTSD affects us. So if you see the little circle that's labelled the amygdala is part of our threat system. Now, its job is to keep us safe. It's a bit like a fire alarm or a smoke alarm to danger. So if we think that something bad's going to happen, then the amygdala says, right, fight or flight response, off you go. And it causes lots of physical changes to our body, which Dr. Debs is going to talk us through. Now, the difficulty is our brain isn't very good at telling the difference between real danger and a danger that might be out there. So if we think about COVID-19 at the moment, we're being told there's a possible danger out there. Now, we don't know if that is a danger to us and our family, but it could be a danger if we come into contact or have come in contact with someone. So that amygdala right now is going to be going into overdrive. Now, if you have PTSD and you've experienced trauma, the amygdala is already more sensitive. It becomes more sensitive to try and make sure we don't get into a more threatened situation. So again, COVID is going to be really exacerbating that right now. And if you look at the other bit that's labelled on this diagram, the hippocampus, so when you experience a trauma, the hippocampus, with a normal memory, let's imagine you walk to the shops to go and get some bread or milk. A normal memory like that would be filed away in your brain. You don't really think about it unless someone asks you, what did you do this morning, or what did you get from the shop? It's filed away like a computer file. It gets tagged with the time and date stamp, and it's filed. We don't think about it anymore. Now, when our threat system is active and we go through something that is traumatic or difficult, that hippocampus doesn't work properly. It says, actually, I'm going to shut down that kind of luxury function, and the brain says, instead, I'm going to focus on keeping you alive and keeping you safe. So the hippocampus doesn't do its job, and it doesn't put that time and date stamp on the memory. So when you experience a traumatic memory, it's not filed away properly. Now, that is why with PTSD, you're getting those intrusions. It's jumping into your mind when you don't want it to, the memory, because it hasn't been filed properly. And that's the brain's way of saying, actually, can we put that memory back away now? Can we process it through kind of psychological therapies? So that hippocampus is the bit that's making it jump out at us. So if I talk you through this diagram here, this is called the window of tolerance. Now, I want you to imagine that this zigzag line here is our emotions. So everybody's emotions every day fluctuate up and down. Now, any fluctuations within these dark lines here that are labelled optimal arousal, we're able to cope with them. It's like, okay, I feel a bit stressed or a bit low, but I'm okay. Now, if they fluctuate above this line, this is what we call hyper-arousal. So as you can see here, it might cause fear, anger, grief, shame, panic, a pounding heart, sweating, trembling, breathlessness, and we just feel like we can't think. Now, if we go too low down here, it's called hypoarousal. We might feel no emotion at all, might feel numb. We might feel like we're going to collapse, we might be unable to speak. Again, we can't think, but it's more because we're kind of dissociative. We've almost left our body emotionally as a way of coping. So this is the hyper, and this is the hypo. Now, when you experience a trauma, these lines here of what we call optimal arousal minimize down to these dotted lines. So any emotion that you feel up here or down here would have been in your window of tolerance. They're now outside. They're going to cause this hyper or hypoarousal. So this is the effect that trauma has on us. And one of the reasons we do trauma therapy is to widen that window back out to the optimal level. But if you think about COVID-19 at the moment, if you're experiencing trauma and you've experienced trauma and you've got PTSD and your tolerance is already in this window, and then you've got constant news flashes talking to you about danger, and you can't see family and you can't regulate your emotions, then all of a sudden you're going to be constantly outside this window of tolerance and really, really struggling at the moment. And I guess that's why we're doing this video, is we wanted to tell you a bit about it, but we also wanted to give you some strategies and help you to be able to cope at a time that is so difficult for us. So I'm going to hand you back over to Dr. Debs now, and she's going to talk to us a little bit more about how it affects the body and what we can do to help it. Thanks.
Well, Dr. Cara gave us a brilliant definition there and explanation of trauma, and I think it's really important because a lot of the people, when they first come into a clinic room, as Dr. Cara would tell you, some of the times their breathing is completely dysregulated. You know, even just trying to share the narrative, their story of trauma, even just listening to some people who are worried about COVID-19, sometimes they don't actually realize that their breathing and their mind is just racing and whirling away. So one of the techniques that we can really do is to think about is to impact on breathing. But most people will say, why is breathing so important to trauma? Why do we even going to focus on such a simple technique? One of my clients once said, well, if I wasn't breathing, I'd be dead. Well, let me just share a lovely little picture with you around the fight, flight, freeze. So when we get affected by trauma, this is what happens. our brain gets filled and literally our thoughts can race. We can get dizziness and lightheaded. But the key point for us is the adrenal gland gets activated with releasing adrenaline. That can flood in about 2 seconds and take about 90 seconds to dissipate. And the thing is a lot of people can get many of these symptoms. In fact, sometimes they can actually be flooded and feel a lot of these symptoms. So if you go into a hyperarousal zone, you're going to get really tense and tight. Or if you go into the hypo zone, you're going to almost not feel your body at all. And I think that's really important. So one of the things we want to do is regulate the diaphragm to kind of soothe some of these systems in the body. So what do we do with that? So one of the techniques is a really lovely breathing exercise, which the Dr. Cara Davey, I'm going to ask you to do this if you can. So I'd like you to breathe in for 5 seconds and then release for 7 seconds. Now, that may sound really hard to do. And if it is really quite difficult, what you need to start with is breathing in for 3 and out for 5 and get that nicely tuned, and then go 4 to 6. But the idea is we go like Dr. Cara and we aim for 5, 7, because that helps start to slow the mind and release the body from all that tension. So that's a really good thing we want to do. So as Dr. Cara breathes in next, you really count that 5 seconds in with us. So 5, 4, 3, 2, 1, out. 6, 5, 4, 3, 2, 1. And just notice how that feels. So Dr. Cara, you may notice things in your mind or your body from just doing some of those breathing exercises. So what we're going to do now is we're going to move on to another little technique, which is really nice, because in therapy, what we have to do is promote this idea of stabilization. So trying to get the person to be within that window of tolerance, because never in the history of just asking somebody to calm down has ever really worked. So what we're going to do is try and create a place in the mind for people to be calm, because like you were saying, they're stuck in a house with people and not able to use some of their own strategies and their own techniques for regulating their own emotions. So one of the things that we're going to look to do is just show how, if you could have a 2-minute timeout somewhere in your house, that you could try this nice little technique that would be nice, and it literally will just make you feel like you're in control of your own mind and body. So Dr. Cara, we're going to do this lovely thing called Calm Place, which has a butterfly hug. Okay. So, but first of all, I'd like you to think about some place or imagine being in that feels calm or special to you. Where would that place be?
I'm on a beach.
Oh, nice. So as you think of that beach, I want you to notice what's around you. Any sounds, any smells. Just notice everything connected with this place. What do you notice?
So I'm sat on a beach. My feet are in the water. I can feel the warmth of the water on my toes. And I'm running my hands through the sand next to me. I can feel the warmth of the sun on my skin. There's no one around, it's just me. It's completely peaceful. I can hear birds chirping, and I can hear the waves moving.
Is it a clear blue sky day?
It is, yeah. Yeah, completely clear.
So what we're going to do is we're just going to get into that butterfly hug whilst you notice your lovely beach. And we're just going to slowly tap alternate hands and just really tap that lovely image in. Really nice and slow. And just notice that lovely warmth of the water on your toes and the sun beating down on your skin. The birds and the sound of the waves. Just notice how that feels. And just pause there for a second and tell me, what do you notice in your body associated with that place?
Everything just feels calmer and slower, quite quieter.
So
my body, I just notice a kind of relaxing of the muscles.
That's really good. Just notice that and just tap that in, that lovely feeling of those lovely relaxed sensations associated with that beautiful beach. Just really notice that warmth on your toes, the warmth of the sun on your skin, that sound of the water. Just notice your breathing and those relaxed physical sensations. And then just pause for a second and just tell me, what are you noticing?
A warm feeling in my tummy, and yeah, just quiet.
That's really nice. Let's just notice that and just tap that back in. Just notice. And then, is there a word or a phrase that would describe that place and how you feel in it?
Yeah, just calm.
Okay, so I want you to notice that word calm, along with those lovely physical sensations of that warmth in your tummy and the relaxed feelings, and just hold those two things together for me. So the word calm and those lovely sensations in your body. And just tap that in. Really noticing that word calm. Okay, and just pause there and tell me, what do you notice?
Same, just quiet and warm.
Quiet, but you see how the mind just quiets down, how the body just soothes. So that's a really lovely technique that we can all kind of practice and do, and it's a really nice little thing. So, and one of the other things that a lot of people need to do with the production of that adrenal gland going off is to think about exercise. And the great thing about this emotional toolkit is there's a whole module on exercise and how to cope with that in the body. But likewise, there's also other modules around anxiety, because anxiety is, like I said, trauma is part of the anxiety spectrum. So I'm just going to hand over back to Dr. Davey just to look at some final words to think about anything else you might think that we need to be doing, especially in COVID-19. So just over to you to kind of wrap us back up, because you did such a great explanation of what is trauma, and that was brilliant to hear. So thank you.
Thank you, Dr. Debs. Yeah, so I guess I would just echo what Dr. Debs has said, which is about trying to find ways that you find calming or relaxing in what is quite a hectic kind of world at the moment. I mean, lots of people have got children at home because of childcare issues where they might have been at school. There's a lot of noise and busyness, and things are a lot more chaotic, and there is that sense of threat. So do whatever it is that helps you to feel calm. You can try that lovely calm place that Dr. Debs has just talked us through. You can try the breathing exercises, but also, as Debs has said, check out the other units on this page. It might be that if your anxiety is affecting you through hand washing kind of beyond what we're being advised to do, to the point that you're really sore, and it might be that you want to check out our module on kind of obsessive compulsive. If it's affecting young people in your house, there is a child and young person module. So go through the modules, find things that would help you. And if there are other things that you would like to know from us or from people on the other units, please do drop us a message and just ask us. And we're more than happy to do another video to talk you through things or to share kind of files and resources that might help you. Stay safe, everyone, and stay calm. And we really would want to help you with that.
Thank you very much.